So Kevin, would you mind if we dig a little deeper into, say, physician practices?
Absolutely, that's a great topic because so many hospitals and health systems are actually employing physicians now. And they're doing it primarily because of healthcare reform. Healthcare reform is moving towards bundling of payments and moving towards a process of preventive care rather than treating illness. And to position themselves for that transition in payment, hospitals and physicians are coming together. Well, there's a variety of problems or issues that are created there with that partnership. One is there's oftentimes not a good way technologically for them to share data. So we have some technology solutions that can bring those disparate systems together and have them share data back and forth, which is important. They're also always looking for ways to enhance revenue and improve quality. We have a process with one of our expert partners that uses the Annual Wellness Visit for Medicare patients. I wasn't even actually aware that this was a benefit, but the government pays for an annual wellness visit for a Medicare age population to go to a physician office and have an assessment of their current physical status and their well-being, and it's a preventive care mode rather than treating illness. Well, there's cash that can be infused into the business by increasing the participation of those Medicare patients, because only about 14% of them actually take advantage of that free service. And it should be 40, 50, 60, 80, maybe, why not 100%, right? The other thing that it does is it creates a database for people to identify other problems or issues that they may have that they need tested for. That brings additional revenues into those practices and helps the patient stay healthier. There's a term called population health management in which organizations are taking on risk. They're basically assuming the care of a population of people and doing it for a fixed amount of money. And so the incentive then is to keep those people healthy, not to put them in the hospital and treat disease. And this process we have with the annual wellness visits creates a database that allows us to identify chronic care management patients or patients that have certain clinical indicators that require additional treatment. There's a very important statistic that is astounding to me, but you'll probably agree that it's feasible. 5% of the population consumes 45% of the healthcare costs in our country.
That
Just
does
5%.
not surprise me at all. I would have thought it was a larger number.
Because
it's sort of the 80-20 rule in reverse.
Absolutely. So if you think about diabetes and congestive heart failure and asthma and chronic lung disease and all of those things that are associated with an unhealthy population, that small group really takes a big chunk of the cost. One of the biggest concerns of chief financial officers today is how do we make that transition of getting paid to treat illness to getting paid to keep people healthy. And that's why many of our best practices sort of relate back to that and how to connect with patients and their families appropriately and care for them in a way that reduces cost.
Well, now that the hospitals that we chat with they're actually now had to change their entire business model the last few years. So are they receptive to that change that they're going now to? We need to be more on the treat the patient versus the other way they had done things over the years.
Well, a major change is that there's a financial emphasis that is now placed on quality and safety standards in hospitals.
And what does that mean?
That means that if you don't meet certain quality and safety standards as an organization, that might be things such as hospital-acquired infections. It might be 30-day readmission rates. It might be surgical infection rates. You're going to receive less compensation than those organizations that do things with higher quality. And of course, the patient has always been the center point of trying to make sure that we do the best job for them, always. But now there's a financial incentive to assure that.